Okay, I'm Adrianna Spadafora. I'm going to do my head to toe assessment. I'll scan the room. There's nothing really to see. Okay, so I'm going to ask my client to walk in. Okay. So as my client walks in, I'm looking at her gait. It's balanced and even. I'm going to ensure my client's privacy by closing the door or the curtains and raising the bed to appropriate level for myself and herself. I'm going to wash my hands with hand sanitizer. I need my stethoscope with the bacteria. So I'm going to be doing a head to toe assessment. Before we start, do you have to go to the washroom?
No.
The client doesn't have to go to the washroom. So I'm going to start. Do you know where we are?
Possible.
Do you know your name?
Deanna.
Do you know what year it is?
2013.
Okay, so my client is oriented times 3. How old are you?
25.
Client looks age stated and her sexual development is appropriate. She has no signs of distress. When I look at my client, her body posture is upright. She's symmetrical. Her body build is normal. She's well nourished. Her color is pale and it's throughout her whole body. And her body size is normal. She's not obese or too skinny. And her head is appropriate sizing for her body. Her behavior, she maintains eye contact. She responds appropriately to the situation. She's dressed appropriately for the situation. And her, said dress. So I'm going to start with her skull. Her head, it's symmetrical. There's no bumps, no bruises, no lesions. Any tenderness?
No.
I don't see any scars on her head. Her hair is distributed evenly. It's dark brown, thick, clean. And moving on to her face. Her face is symmetrical. Her color is evenly distributed throughout her face. Her hair is distributed evenly, her eyebrow hair, her eyelash hair. I don't see no bumps or bruises, no lesions on her face. I'm going to do cranial nerve 7, facial nerve. Can you frown? Can you smile? Can you puff your cheeks? Show your teeth? And don't let me open the jaw. Raise your eyebrows. Cranial nerve 7, facial is intact. Moving on to her eyes. Her eyes are symmetrical. Her two eyelashes, 2 eyebrows. The hair is distributed evenly. Her sclera is off-white. There is no crusting coming out of her eyes. No lid leg and no prominent blood vessels in her eyes. So I'm going to do cranial nerve test ocular motor. So right now her pupils are about 3 millimeters. Yeah, 3 millimeters. So I'm going to do direct and consensual light. So shine, direct, consensual, and then I want you to look off into the distance, and then I'm going to bring my pen and you're going to focus on the pen. So look off into the distance. Her pupils are dilated, and as I bring my pen closer, they should constrict. And her eyes constrict. So from her eyes, we're gonna go to her ears. Her ears are at appropriate levels with her eyes. There's no serum, there's no crusting. I'm going to palpate her auricle and her tragus. Any pain or tenderness?
No.
No pain or tenderness in her ears. Moving on to her nose, it's symmetrical. No crusting, no bumps, no bruises, no lesions. Then I'm going to palpate her sinuses, so her frontal, any pain or tenderness, and her maxillary, pain or tenderness. Okay, so from her nose, I'm moving on to her mouth. So her mouth is symmetrical, her lips are moist and pink. Can you show me your gums? Her gums are pink, moist, no bleeding. Her teeth are present, no loose teeth. Your tongue is symmetrical, moist, pink, no cracks, no bleeding. And her hard palate and soft palate are pink and they are not inflamed. At this point, I am going to do glossal pharyngeal and hypoglossal nerves, cranial nerves. So 9, 10, and 12. So we'll say soft palate rises. And now I want you to say light, tight, dynamite.
Light, tight, dynamite.
No tremors, and then stick your tongue out and go from left to right. Okay. Cranial nerve 9, 10, and 12 are intact. Now I'm going to do your spinal accessory nerve, which is cranial nerve 11. Tilt your head to your left against resistance. And now your right against resistance. And then shrug your shoulders. Cranial nerve 11 is intact. Moving on to her neck is symmetrical. No bumps, bruises, no lesions, no scars, no obvious enlarged thyroid, and no striding. There is one bleeding mark. And at any pain or tenderness?
No.
Warm, soft. No edema. And turgor is good. I'm going to palpate your carotid artery. +2, normal. +2, normal. Equal bilaterally. Moving on from your neck, I am going to go to your arms. Your arms are symmetrical. No bumps, no bruises, no lesions. Warm, any pain or tenderness? Turgor is good. No edema. Hair is distributed evenly. Color is maintained throughout the arms on both sides. No scars, no striding. And at this point, I'm going to do the grip test. So I'll put grab my 2 fingers and squeeze. So equally strong. And I'm going to do her radial pulse. +2, regular, equal bilaterally. So now I'm going to do range of motion. So I want you to flex your elbows, extend your elbows, flex your wrists, extend your wrists, extend your fingers, flex your fingers, supinate your elbows, point at your elbows. I mean, yeah, point at your elbows. Shrug your shoulders, depress your shoulders. Internal rotation of your shoulders, external rotations. Going back to your wrists, ulnar deviation, radial deviation. And going to your fingers, I'm going to do Hillary V club. 2 seconds, no signs of clubbing. And then moving on to your legs. Kiss your legs. 2 more. I need to see that. Okay, so there's no bumps, no bruises, no lesions, no scars, no striae. Hair is distributed evenly. Warm, soft, no edema. Skin turgor is good. And then from here, I'm going to palpate her dorsal pedis pulses. +2 equal bilaterally. And her anterior tibialis. +2 normal equal bilaterally. And then I'm going to move on to your abdomen. Can you push your legs over? Face this way. I'm going to go move on to her abdomen. Okay, so symmetrical, no bumps, no bruises, no lesions. It's pale, hair is distributed evenly. And at this point, I'm going to listen to all 4 quadrants, starting with the left lower quadrant. Gurgles are present. And I'm going to palpate the abdomen for any tenderness, masses, any tenderness. And palpate the bladder not palpable. And then from here, I'm going to do her chest. Anyway, move over. Okay, so I'm gonna listen to her heart sounds. So I'm gonna start on her right side. Second intercostal space is going to be her aortic. And here you hear S2 the loudest. And then moving on to her left side, second intercostal space, mid-sternum. You hear pulmonic, and here you hear S2 the loudest. Moving down to third intercostal space is Herb's Point, and here you hear S1 and S2 equally. Moving down to fifth intercostal space, mid sternum. You hear tricuspid, and here you hear S1 the loudest. Moving on to intercostal space 5, mid-clavicular line. Moving around here. You would hear mitral, and at mitral you hear the S1 the loudest. And as I listen to her heart sounds, I hear no S3 or S4s. Heart sounds are normal, and her rate is about, I'm say 58 a minute. Her chest is symmetrical, no bumps, no bruises, no lesions, warm, skin turgor is good, no edema, any pain or tenderness,
No.
and soft. Okay, so I'm gonna move on to your lungs. So can you please sit up and just face the back of the bed? I'll put you back. Okay, well, her back is symmetrical, no bumps, no bruises, no lesions, no edema, turgor is good, warm, soft, hair is distributed evenly. I'm going to listen to her breathing. As every time you feel my stethoscope touch your back, take a deep breath in. So as I listen to her breathing sound, every time she breathes in, I don't hear no wheezes or crackles. Her breath sounds clear, and her breathing rate is about 18 in a minute. Oh, going back to her legs, I want to do dorsal flexion and plantar flexion. Go back to dorsal. Okay, so dorsiflex against my hands. Dorsi. And then plantar flex. Okay. Which is good. That's something.